Hi, I'm Matt Jeffs. We're here in St. Augustine, Florida, speaking with Dr. Pierre Angers. Dr. Angers, good to have you here today.
Well, thanks. Glad to be here.
Your special area of interest, I understand, is cardiology. Can you tell us a little bit about that?
Well, to be clear, I'm not a cardiologist.
Oh,
I'm a primary care doctor, board certified in family practice. I'm residency trained. And the reason I chose family practice is because I'm very interested in preventative medicine. And, you know, people don't come to the doctor for prevention typically. They come to the doctor because something's wrong.
Right.
And a primary care doctor is in a great position to offer them help in terms of picking up problems, whether it's heart disease, diabetes, other problems that they may have. So that's why I chose the field. And like most family doctors, a lot of my patients are coming in with heart problems.
Precisely. It's very common, isn't it?
Yes, it is. In fact, it's still the leading cause of death in America. Over 700,000 people a year die of heart disease.
Now, as far as treatment options for heart disease, I've heard an awful lot of people go for either stents or surgery. Let's start with stents. What are stents?
Stents are metal meshes. They're tubular in shape. And the cardiologist can insert this into a coronary artery that might have a narrowed area, what we call a plaque. And the idea is to prop that space open so that you have improved blood flow. The studies show quite clearly that having a stent will not prevent you from having a heart attack, and it will not help you live longer. This is very clear, and I've had several cardiologists confirm this. So when would someone have a stent, or when does it make sense for someone to have a stent? Well, if you're having a heart attack and the cardiologist is available, and you can have a heart catheterization done within 2 hours of getting to the emergency room, it makes sense to have a stent.
Got it.
It can help reperfuse or get the blood flowing back to your heart muscle. The other time it makes sense to have a stent is when you have angina or chest pain or other symptoms related to your heart that cannot be treated conservatively. Then sometimes a stent can be quite helpful. But again, I want to be perfectly clear. It will not prevent a heart attack, and you won't live any longer if you have a stent. Now, some people that are listening to this may be shuddering a little right now because they have stents.
Yeah.
And I want to say that there are some things you can do to keep your stents from stenosing. And that means closing up or clogging up.
What's that?
One is to take high-dose B vitamins.
Really?
We have, again, no idea why this happens. But folic acid, pyridoxine, and B12 in really high doses prevents the restenosis. In some cases, it helps prevent restenosis of the stents. Certainly, you shouldn't go back to smoking, like a lot of patients do. You should maintain a healthy level of exercise and a healthy diet. Keep your cholesterol low. These are the things that will help prevent you from having clogging again of the stents.
That is a stent, then a surgery. It's because what you described sounds somewhat invasive, but a surgery would be even more so. Is that correct?
It's a very invasive therapy. About 4% of people die from the surgery itself. About 10% of people have a heart attack as a result of the surgery. And at least 25% of people have permanent brain damage from the surgery.
It's not without its risks.
And here's what's disconcerting about this.
Please.
In many cases, the bypasses will clog up again. Bill Clinton, former President Bill Clinton, is a case in point. He had bypass surgery, and just 2 or 3 years later had to have 2 stents put in because they were already plugged up.
Wow.
And they may not be all that helpful. In fact, there's been a number of studies that show that having bypass surgery offers no real advantage over just having conservative medical care.
I remember something about a CAS study from 1980. Can you share with us that?
Yes. The CAS study was published in a journal called Circulation. It's a very prominent journal. And it compared patients that had conservative medical care to bypass surgery and found that there really wasn't any difference in the outcomes. The one exception being were the patients that had decreased ejection fraction. Seemed to do a little better. Ejection fraction is really the amount of blood that the heart pumps. But then on top of that, there was recently a study called the STITCH trial, just published in April of this year, which looked again at this. And they looked at patients specifically with this decreased ejection fraction. And with those patients, again, there doesn't seem to be any statistical improvement in their outcomes. So there's a big question as to why we continue to do so many of these bypass surgeries. And of course, there are times that people need surgery. I'll give an example. A good friend of mine who was 56 years old had a complete blockage of the main coronary artery called the left anterior descending artery. And she tried a variety of conservative measures that we'll talk about later today, but they didn't work very well for her. She tried, but they didn't work. And I encouraged her to have bypass surgery.
Right.
And as it turned out, even though it took her 3 months to recover from the surgery, she's doing much better. So there are times when people feel weak or they have accumulation of fluid in their lungs or their legs as a result of their heart not pumping effectively, when the best thing for them may be to have the surgery.
Are there examples in your experience where maybe it wasn't the best outcome?
Quite a few, unfortunately. And one recently that was rather disturbing to me was a gentleman around 80 years old, approximately 80 years old, and really was healthy. He didn't have many problems, but he was determined to have some coronary artery disease, but no symptoms. He had no chest pain. He had no evidence of problems with congestive heart failure or problems with his heart pumping effectively. And yet the surgeon literally scared him into having the surgery. It does happen, unfortunately.
Are there options for people other than stents and surgery?
Absolutely.